Hello everyone, I'm Dr. Atul Pandey, and today I'll be talking to you on epilepsy and its associated learning disability and learning problems or intellectual disability as we may address it. Now, epilepsy is a disorder that involves a constellation of symptoms that vary in frequency and in intensity from child to child. Of these, the children with epilepsy, approximately 25% of the patients continue to experience poor seizure control, and even with anti-epileptic drug therapy. In addition, it is also seen that epilepsy in children is also associated with problems in multiple areas, including academic achievement, behavioral and emotional adjustment, and social incompetence. Even with good and well controlled seizures on anti-epileptic medication, the problems may persist because of abnormal brain function or brain formations or continued anti-epileptic drugs, the side effects of the anti-epileptic drugs which are being given to those patients. Now, although overall intellectual ability in children with epilepsy is comparable to the normal childhood population, they are at a great risk for learning problems and academic underperformance. Even in those with normal intelligence, reports of deficit in specific areas related to thinking and learning abilities are very common, particularly in the areas of attention and concentration, memory, organization skills, and academic achievements, which is also included in those performance. Now, many children do not fit the typical school definition of learning disabilities, as their reading, spelling, and math skills may be appropriately developed, but they do have a significant challenge for learning due to particular areas of weakness as described above, such as attention, concentration of memory, and organization skill. Now, common learning challenges for children with epilepsy are paying attention and concentrating, understanding instructions, using information, describing things to other people. These are the areas in which these patients or the patient children with epilepsy particularly have problems. Now, remembering, working out how to do something new, organizing thoughts or tasks. Now, these are the other sectors where they might face some problem. Now, feeling you have no energy to do things, feeling of muddled up or confused, feeling sad and tearful, feeling short tempered, working out slumps, writing or copying fevers, and developmental delays. Now, these are the other areas where these children with epilepsy have to face challenge in their day-to-day life. Now, learning is very important in people for all ages, not just children. Likewise, the impact of epilepsy on learning can be experienced at any age. The extent of the impact is very individual. Some learners are greatly affected and other might not be. Now, the impact that epilepsy has on our learning can be related to the type of epilepsy you are having and the cause and the brain regions where it affects, and as well as the treatment we are getting to treat those epilepsies. Being absent on school, training due to seizure may also affect your learning. As those children who are having seizure, they will miss schools more, they will miss the trainings, and so on. They will have a lacking or reduced learning chances. Now, the ability to make sense of new information is crucial to successful learning. In children with epilepsy, there might be some problem in making sense of new information, cognitive issues, or learning difficulty. Now, this may negatively impact their academic outcome and behavior. Memory is, memory is basically a very complex process that occurs within the brain. Now, it allows you to store, retain, recall information and experiences. Although not all people living with epilepsy experience memory difficulty, but it is the most common challenges reported by the people living with epilepsy. Now, there are many difficulties and many type of memory difficulties that a person may have while having epilepsy or due to the treatment for which for the epilepsy he is taking. Now, various support groups are there and various services are there to help this patient to plan and navigate the learning journey. This can be customized further to suit the unique situation and needs of each patient. And on this day of World Epilepsy Day, I must say that it is a very important topic and it's a very important thing to note down or to address this cognitive difficulties the patients with children with epilepsy have. And we should encourage them and we should help them not only to control the seizures but also to help them increase their learning abilities from day to day life. Thank you.